Hi everyone, my name is Peter. Welcome to my YouTube tutorial. In this section, I'm going to be discussing carbamazepine, which falls in a pharmacological group of immunostimulants. So this is a continuation for my anti-seizure drug tutorials. So therefore, today's objectives, we shall look at the mechanism of action of this drug and side effects of the drug, and also some of the contraindications. So therefore, to jump into the objectives, so the mechanism of action of this drug is the same as of that of phenytoin, as we saw. It blocks the repetitively firing sodium channels in these very active neurons in the focal area where a seizure begins from. So this causes what we call hyperpolarization of the neuron, and it prevents further or that repetitive firing of the impulses in nerve cells, as it is seen in that state of having a seizure. So therefore, we have other conditions where we use this drug other than the partial, complex, and the genotonic seizures. We use this drug in bipolar depression. This is due to its tricyclic structure. Carbamazepine qualifies to act as a TCA due to its structure, and also we use it in trigeminal neuralgia. So we shall discuss this in time to come, but as for now, we are focusing on its use in seizures. So therefore, some of the side effects that it has, one of the most common one is the gastro upset. So therefore, this gastro upset can be overcome by taking this drug with a meal. And some other side effects seen with this drug are vomiting, nausea, and granulocytopenia, thrombocytopenia, and then hypersensitivities, sleep, it induces sleep, dizziness. So I'm going to highlight a few of these side effects because there's some of the side effects we see in the toxicity of carbamazepine. So if a patient begins to have sleep, dizziness, and nausea and vomiting, so these are some of the indicators that a person is having what we call a carbamazepine overdose or toxicity. So in that case, we have to do what we call carbamazepine test, whereby we test the amount of carbamazepine or the concentration of this drug in the blood. So therefore, when it exceeds a certain amount, that is, I think is it 15 micrograms per liter, then the patient is having a drug toxicity. So therefore, but most of these other cytopenia, hypersensitivity, and granulosis are due to what we call the metabolites. So this structure of carbamazepine can be deactivated by the liver enzymes, and some of these liver enzymes, what they do is that they put a water soluble group on the carbamazepine. So this reduces this structure to something like this. So this is what the liver enzymes will do. So they'll take off this and put a OH here on this group. So this becomes what we call so this is 2-hydroxyl immunostilbene. So this immunostilbene and another metabolite, whereby this is converted to a ketone. This part is converted to a ketone. So these two products are the ones responsible for what we call the induced hypersensitivity syndromes we see in carbamazepine. So these metabolites are play a vital role in eliciting what we call immunoresponses, hence giving this drug it's this type of hypersensitivity. So therefore, we should use caution when we are giving this drug with patients having a history of these hypersensitivities. And also another last condition that we have to know, point we have to know under carbamazepine is that they cause what you call they are auto-inducers. So carbamazepine induce enzymes that work upon carbamazepine itself. So therefore, it induces its metabolism, and also induces the metabolism of other drugs, such as it induces this type of enzymes 3,4A, as we saw in phenytoin. So these enzymes will act on drugs such as felbamate, valproate, drugs like cimetidine, the macrolides, drugs like theophylline, and many other drugs that are metabolized by this enzyme. And carbamazepine increases the levels of phenytoin, since phenytoin also induces this type of enzyme. So therefore, carbamazepine given together with phenytoin will increase the concentration of phenytoin, because it does not induce the enzymes that metabolize phenytoin. So that's another point to note. And also you should know that macrolides such as azithromycin and erythromycin increase the toxic effect of carbamazepine by inhibiting the metabolism of this drug. So those are some of the ideas that you should take home as far as carbamazepine is concerned. So, like I said, in contraindications, we do not give this drug in patients with cardiac diseases such as congestive heart failure and cardiac arrhythmias, because some of one of the side effects I forgot to put here is the cardiac disturbances. So if a drug has cardiac disturbances, so then we should use caution when you're giving it to patients with congestive heart failure, patients with cardiac arrhythmias, and also carbamazepine can be contraindicated with patients who are taking antibiotics like the macrolides that we saw, because you need to adjust a dose, because these drugs inhibit the metabolism of this drug. So the concentration of carbamazepine will go up when you give it with macrolides. So therefore, briefly, that was carbamazepine in short. Thank you for watching. Catch you next time. Bye for now.